and over 100 of these people were members of WhatsApp groups that were kind of focused on these activities, and 34 active volunteers. Some of these activities include like walking, cycling and exercise groups, a confidence club for children, an SEND carers coffee morning, etc. So we were a busy bunch. Next slide, please. Okay, so during COVID-19 and the early stages, the immediate thing that we had to adapt to was working remotely. We've talked about some of this already with Alice. So the team set about contacting active volunteers via WhatsApp groups and one-to-one phone calls. They found that these phone calls took on a whole kind of, they made people's relationships a lot deeper than they might have been in the past, with people really sharing some of their fears and concerns about the current situation. We also found that the WhatsApp groups that were mainly around logistical information took on a whole new function, and they became places of sources of support and information sharing. The team, we set about mapping local support in the 3 areas that we're based, reaching out to lots of other local organisations that we already knew about, and we were able to learn about some new organisations that weren't on our radar before, which was brilliant. Another thing that we've seen happen is that there's some new coalitions and groups of people who are working together who weren't previously, to respond locally to people's needs around, particularly around like food and medication deliveries. In addition, we became involved with crisis social prescribing or proactive wellbeing calls as a team. So at the Bromley by Bow Centre, we work closely with the Health Partnership, and Emma's going to tell you much more about this in the next part. But we've been making some proactive calls to patients on a low mood list, which means, well, it's been an amazing opportunity actually for us to speak to people who we might not otherwise have spoken to, and to tell people about the project and ways in which they might be able to get involved and link in with communities driving change, as well as all of the other support available to people. A lot of the work that we've been doing has been around digital inclusion. So lots of our participants have some wherewithal to get set up and perhaps join a video call, but they've needed quite a lot of coaching, some people. So the team have been doing a brilliant job with that. Now we know that not everyone is able to connect for a number of different reasons. And it's a massive issue that we're all kind of concerned about, and we're looking at how we can make sure we're adapting and including people who aren't able to join online activities. So yeah, just to give you an example, we've had online resident meetings, we've had an online book club start for 5 to 10-year-olds. But yeah, like I said, not everyone's able to access that. I also wanted to tell you a couple of stories about how the networks that we'd already created and had really kind of activated during COVID-19. So we have one participant in his 70s who lives alone, was self-isolating with suspected COVID and had run out of paracetamol. So in one of the activity WhatsApp groups, we are able to have a call out, and locally some of the residents who lived in the same block as him were able to drop paracetamol outside his door. So just to kind of give you a sense of that immediate response that people were able to offer because of the networks that were already in place. Another story is a woman who was self-isolating with her 4-year-old son with suspected COVID-19. She moved to the UK recently and not a very confident English speaker. And she didn't know many people in the local area. So she told the coordinator that she was worried about how she was going to get some food. In the end, we were able to link her up with a group of women who ensured that the family had food. And it was a nice story of teamwork, including one participant who worked at a supermarket saving food for her at the time because there was quite a scarcity at that moment. So why is this important? I think it's valuable to remember that the objective of our project isn't to prepare communities to cope with the global pandemic, like I'm sure most of your projects and work, but I think it really does support the argument that we're better equipped to weather challenges when we're more connected. One of the other pieces of work that we've been doing is looking at what can be done from home, and there's a lovely, the next slide has some images or stills of a video that mums from Old Ford Road have created, and it kind of followed a day in the life of, and it was a really nice activity for people to do, and also for them to build skills that might be useful to them in the future. As I mentioned, going on to challenges, so adapting to working remotely was tough. We also spent a long time working with some of the misinformation going around in the WhatsApp groups. Information just became really important, and it was clear that we needed to be providing people with reliable, trusted sources. Yeah, the digital divide has been kind of emphasized by this whole crisis. So really keen to hear any of the interventions or ideas that you might have for how we can tackle this. It's been tough just not having a physical presence, because lots of our work is face-to-face, and to reach out to new people and do that estate-based outreach. I saw some comments in the chat box earlier as well about kind of knowing when to reach out, and understanding that people have got all of these new demands on their time and their different priorities, for example, homeschooling children, worrying about, have I got enough food? So I think we have seen a kind of, there was definitely a lull of engagement, but we've been managing to get back to a good level now. Next slide, please. So what we're planning now is a community, what we call a community voting day in Old Ford Road, where it's like a participatory grant making approach. So we had wanted to have this take place in an event in person, but we're having to plan this as if it were going to be online, which is a really brilliant, interesting challenge. So there's going to be call outs for local people to apply for their project ideas. We're starting a coaching community that will take place online through video calls to allow people to support each other with their local project ideas. And more broadly, we're looking at the kind of longer term vision and how we can support communities in their recovery. So just to kind of end, here are a couple of snippets of WhatsApp messages that we saw. So if you could go to the next slide. One of them's from the woman I mentioned, just saying what it meant to her, actually, the support that the group were able to give. And another comment from one of our members about how good they feel about being able to contribute.
That's great. That's awesome. Do you want to, I think we only have time for a very quick question. And I just want, because I see that a lot of mention about that, about obviously we know that a lot of people are not, cannot be online or things like that, but like how do you engage with them? How do you make sure that they're not completely isolated? You know, if they can't attend any Zoom meetings or chat on WhatsApp or things like that, how does it work? And before you answer, I just want to mention someone mentioned that it would be a good topic for us in next session. And actually we have our following webinar on the 9th of June will be about that, specifically virtual communications and how we reach out to everybody and how we can make sure we support the whole community. So we'll be talking more in depth about this. But yeah, for now, Jess, if you want to let us know a little bit more about how you've been dealing with that issue.
Yeah, I think we just have to see with what is possible, how are people able to connect, and if it's on telephone, how can we support those people to speak and connect with others through perhaps even a landline. I think this topic needs lots more attention. It's great that there's a follow-up webinar. Some really interesting questions in the chat box as well. I'm sorry, I don't think I have time to ask them, but in the next slide, I've got my email, so please do get in touch.
Perfect. And what we're going to do is select a few questions in like some categories of questions, and I'll submit it to you guys so you can answer them, and then we'll publish this in the follow-up write-up, so you can answer them in written. I know it's not the same, but if there are some specific questions, we can do a follow-up in written afterwards. So thank you so much, Jess. Sorry, we're kind of running after time. Turns out that webinars are always a little bit longer than planned. So thank you very much. Like we said, everybody, you can still ask questions to Jess afterwards and send me questions otherwise. We'll now move on to our last speaker. So Emma is going to give us a short presentation and a little bit of discussion about long-term change. So Emma, are you
here? I think, yeah, hello.
Hey.
Hi.
So we're going to run a little bit over time, but that's fine. I mean, this is recorded, this part is recorded. I have to say to everybody, I forgot to record the beginning of the webinar, to be completely transparent with you. So, but the end is recorded. So yeah, Emma, I'll hand over to you now. And yes, if anyone has to leave now, don't worry, this will be recorded and shared.
Great. Yeah, so it was really hard to plan for this actually, because I kind of anticipated that what people would be interested in would be very varied. So I'll kind of maybe speak for a bit less time and then try and pick up some of the questions in the chat. So just like many other people, so my natural habitat is a GP practice. I run a team of people who kind of deliver a range of community-based support. So things like walking groups, support groups for parents, a range of different things, as well as kind of trying to improve our day-to-day primary care services to meet the needs of our community better. So when COVID hit, we were also having to kind of think about what can we do differently and how can we still maintain a lot of our ethos around caring about people's wider determinants of health in a pandemic kind of environment. So we had a few principles of things that we wanted to think about. And so I can see one of the questions that recently popped up was about, you know, are we focusing on those who were identified by the government as most vulnerable on the shielding list, or are we actually taking a broader look at all of the vulnerabilities that exist in our community and thinking about how we can reach as many people as possible? So as many of you will know, communities with certain kind of characteristics and socioeconomic profiles will have been hit a lot harder from the pandemic. So for us, vulnerability wasn't about people shielding. Actually, it was about the whole range of situations that people would be facing. So whether it was things like Alice was mentioning earlier around domestic violence, mental health issues being exacerbated, people being furloughed, just a whole range of issues, we knew that actually that was a lot higher than the 100 or 200 people that were identified as needing to shield. Berenice, if I can just ask for the next slide, please. So a couple of things that we needed to think about when sort of redesigning and rethinking about our services. And I have to say, it's very weird. It's a very weird time to reflect, because we're still very much in it, and we're still very much kind of flexing our services to meet needs that change on a weekly basis. But really, it was about the main things that we focused on were around increasing our outreach. So we know that for our footprint, which was around 50,000 patients in our PCN, a large majority of those people were going to need support in one way or another, and that is actually a lot more people than were coming through our doors, particularly as we weren't seeing people face to face anymore. So we really had to think about how we segmented our populations and found ways to connect with people who we thought might need support. So this is where our primary care data had a leading role. So obviously with things like System 1, EMIS, so all of the link working crew out there on the call kind of be able to attest to this, that recording information in systems allows you to then extract it and do more proactive and more targeted outreach with it. So that has been a real kind of benefit to the work that we've been able to do. We have implemented a system of proactive telephone support, which then leads into other sources of support, which are either online or more more regular kind of phone chat. So speaking to the point about what do you do with people who aren't able to be online, lots of our support has been over the phone and has included kind of personal projects. So setting conversations with people around who would you invite to dinner for a dinner party, and people have really loved kind of taking the time to think about what they would plan, what they would do, ready for the following conversation. So we've had some really good feedback from that. And then it's also been about increasing the capacity of the team. So given the fact that we had identified this much broader group of people and larger community that would need support, we also needed to find a way to mobilize other members of the team that could support this work. So really gratefully, we've had a lot of support from others in our primary care network, and of course the Bromley by Bow Centre and other staff at the GP practices to kind of come together. So we're now about a team of about 12 people, not all full-time, but a team of about 12 people that provides us really good coverage to be able to make a lot of these calls and do a lot of this outreach, which has been fantastic. Next slide, please, Berenice. Oh, sorry, I'll skip this one. Next slide, that's fine. Oops, I think it's gone the wrong way. Next one. Yeah, so yeah, just thinking about our vulnerable patients. So this slide is just an example of one of our pathways, and we've got three really. So the shielding list, so they are people who, as I can see people popping up in the chat, people who have a range of clinical needs that deem them extremely vulnerable from the pandemic itself. So we have taken a population health approach to supporting those people and made full use of the Good Sam app and the mutual aid groups, and also the government support that's available from them, but also making sure that when we have conversations with them that we're taking into consideration their broader needs as well, not just their clinical needs. That is different from a lot of practices. So a lot of practices are making these calls from a clinician, but actually it's our non-clinical team who are making calls in the first instance. Then we've had people who would normally be referred to social prescribing, and our numbers across the broadest sense of social prescribing have really shot up. So it's not just the clinicians that are referring people into social prescribing, but it is really everyone from receptionists and patient assistants to healthcare assistants, people who are thinking actually who might be in a bit of trouble during this pandemic and how can we connect them to the right support at the right time. So we've really kind of, again, flexed our team to be able to respond to all of those patients. I'm whizzing through, Berenice, if you go to the next slide, part of what we've been, yes, the slides are a bit hazy, but I'll make sure, yeah, we can send them out so they're clearer when you get sent them. So far we've spoken to a total of 338 people in this way, and many of these people have required follow-up conversations. So we've had everything from people requiring people requiring or requesting phone calls every day to people just wanting one phone call. So our total contact level has been just under 600. So we are really making our way through a number of people in the community, and it is a mixture of people that have been referred in to us and proactive calls. So that's us kind of mining the data that we have and deciding on who we should be speaking to, whether it's people with codes of low mood, vulnerable families, people on the at risk of flu register, over 65s, people who are lonely. It kind of covers the whole spectrum. And in terms of what people are saying they need support with, it has really been overwhelmingly around food and access to kind of basic things and basic well-being. So financial health, home environment, and making sure that people have just those kind of day-to-day things. But it has also really surprisingly been about connecting to other people as well, and also connecting back into the service. So we've had a lot of feedback from patients saying, wow, thank you so much for calling, I thought I'd been forgotten about. So just really this mental health explosion, exactly that. So a lot of anxiety kind of growing in the community. And I think this is where the case for more social prescribing link workers has been really blatant in our area. So making sure that we've got the resource and capacity available to kind of ride this wave as the pandemic starts to shift and change to meet the needs of the community. So what have we learned from all of this? So a lot of it has been very quick. So having a sort of rapid test and learn approach has been absolutely paramount. It's interesting, a lot of the chat has been about how often is often enough to meet. Our team currently meet weekly, and that allows us to do a couple of things. So we reflect on the work that we've been doing on a weekly basis. So, and we make changes based on that. So if we find that something's not working or something working very well, then we kind of adapt to make sure that we're kind of doing more or less of those things that are kind of helping or not helping the service. And that reflection also helps us to feed to managers above and also outside as well. So it helps us to make the case for the rest of our social prescribing link working team. So rather than, I know somebody in an earlier chat was talking about being pulled in lots of different directions, by sort of doing very regular snapshots of what's going on, we're able to kind of keep our justification and rationale for working in the way that we're working very live and very current, so that we can match what we're doing to the needs that we're seeing in the community. Berenice, can I just ask you to pop onto the next slide, please? So yeah, leadership and governance has been a complete kind of flexible feast, really. We've really had to work quite closely together across a number of managers and across a number of teams and across a number of funding streams to really be able to kind of create a cohesive response that makes sense to the community and also to practitioners that are using this support to support patients. I'm skipping through some of these, but data again has really been a really important part of what we've been doing, kind of capturing what we've been doing and what we've been learning as we've been going along to kind of, again, build the case for future funding and make sure that we're really kind of making sure that services and projects that we develop off the back of what we're hearing is reflective of the changing needs in the community. And again, just touching on training as well. So those that weren't already social prescribing link worker trained have really benefited from support from the link workers and from the social prescribing team to be able to have those open-ended conversations, really let the person on the other end of the phone lead what the conversation should be about. So whilst we are checking a range of things when we're speaking to people, it really is about that person just expressing what they may not have expressed to anyone else in what could be a number of weeks. So training has been a really big, training and reflection, I would say, have been a really big aspect of the work that we've done so far. We've kind of zoomed in on one area of work that we've been developing, which is around kind of crisis social prescribing, just to kind of demonstrate what's changed and how we're going to take this into the future, because I think this has been one of the things that has really allowed us to fulfill a lot of the visions that we've had about kind of integrated and population health-based working for a long time. and it's allowed us to kind of test and learn quite rapidly about what works and what doesn't work in this way. So yeah, that's it for now.
That's great. Thanks so much, Emma. I think we may have just a minute to take one question if anyone has anything to ask now. Otherwise, like we said, just send over your question to our email address, and we'll be answering any questions that hadn't been answered in the chat box earlier, and any question you might want to send later on. Someone asked impact reporting.
So we just very briefly, it's mostly about kind of reporting on need at the moment, but we will shortly be implementing the MyCore in line with the wider social prescribing team, the MyCore wellbeing scale to all of our calls. And then it really is about kind of volume and reactions at the moment. So how helpful have people found the service, and what would people kind of change?
Great. So we'll be producing a write-up by the end of this week, answering some more questions in written. I'll also be sending a feedback survey. If you can please let us know what you thought about today. That was our first webinar for the Knowledge Share program. So if you let us know what we should change and what you liked as well, that would be great for next webinar. As you can see on the screen, normally the next webinar will be on the 9th of June. So we're trying to change up days in case people have some fixed meetings on Thursdays, for example. So we'll be doing 12 on the 9th about virtual communications. The title is purposefully a little bit provocative, but we'll be discussing the challenges and how we deal with these kind of things now and in the future as well. So thank you very much for attending, and sorry we ran over a little bit and didn't have so much time for questions at the end. Yeah, I mean, if you have any questions, anything, you can always contact us. The email address for the Knowledge Share program is insights@bbbc.org.uk. You can find it everywhere on our website or on Twitter as well. So thanks again, and we'll put an end to this webinar. Thank you to the speakers. Thank you so much, you three. And hopefully I'll see you on the next webinar. So bye now.